بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. I'm Dr. Nora Sabah from Kerbala Medical College, and I will present to you my lecture which is about preterm labor. What I will cover in the lecture: first, what is the definition of preterm labor, and what are the risk factors of preterm labor, what are the complications that occur because of preterm labor, and how we will predict and prevent preterm labor. One of the important methods of prevention of preterm labor is cervical cerclage. So we'll talk shortly about its definition, types, and what are the indications and contraindications of cervical cerclage, and what are the complications. Then we will talk about the diagnosis of preterm labor, and after that, the treatment of it. First, what is preterm labor? It means labor that occurs between 24 weeks to 36 plus 6 weeks of gestation, which means before 37 completed weeks. The WHO divides preterm deliveries into 3 periods. First, moderate to late preterm births, which are the deliveries that occur between 32 to 36 plus 6 days. Very preterm births that occurs between 28 to 31 plus 6 days. And the extreme preterm birth, which occur between 24 and 27 plus 6 days. Preterm labor can be categorized into 3 main categories. First, which is spontaneous preterm labor that occur in about 50% of cases. Preterm labors that occur secondary to preterm, which is preterm pre-labor rupture of membrane, and this accounts for 25% of cases of preterm labor. And delivery for maternal or fetal indications, which means the iatrogenic preterm labor, and this accounts for 25% of cases. Generally, the incidence of preterm labor is between 7 to 12% of cases, so it is a common disease, and because it is a common disease, it is important. What are the risk factors for preterm labor? These risk factors can be the cause of preterm labor or preterm, and they are divided into 3 groups: the non-modifiable major, the non-modifiable minor, and the modifiable minor. What are the non-modifiable major factors? Patients who have history with preterm labor in her previous pregnancies, patients who have infection in her current pregnancy, any type of infection, whether it is locally in the uterus or systemic infection, vascular causes, which means patient presented with antepartum hemorrhage, patients with Mullerian duct anomalies also is a factor for or risk factor for preterm labor, overdistension of the uterus, which lead to stretching of the myometrium. That stretching may cause initiation of contraction, and this occurs in cases with polyhydramnios, multiple pregnancies, or in cases of macrosomia. Intercurrent illness, any disease that may complicate the pregnancy, for example, hypertension, diabetes, any connective tissue disease, whatever, because these illnesses may lead to stress or maybe the cause for iatrogenic preterm labor. Cervical weakness, which is cervical incompetence, and idiopathic causes that till now we didn't know the exact cause. The non-modifiable minor is first of all the age of the woman, teenage pregnancies, the parity, patients who are nullipara or have 5 or more children, the ethnicity, it's more in black women, and patients who are poor socioeconomically also may have risk for preterm labor. What are the modifiable causes? First of all, smoking, drug abuse, low body mass index, which is below 20, and when the inter-pregnancy interval less than 1 year. This is another diagram that presents the interplay of the causes of preterm labor. For example, here, infection, ascending infection from the lower genital tract to the uterus will lead to cervical weakness, and cervical weakness by itself may be a cause of preterm labor. Or the infection will lead to stimulation of uterine contraction, sometimes may be a cause of antepartum hemorrhage. Patients with multiple pregnancy, this is a stressful condition for the mother and the fetus, and stress by itself may be a factor for preterm labor. Multiple pregnancy will lead to uterine overdistension, and uterine overdistension may lead to preterm labor, and etc. What are the complications? I will not mention all complications of it, but preterm labor is the leading cause of perinatal death and disability. Risk of a neurosensory disability, handicap, and abnormal social behavior. The mortality rate increases from about 2% for infants who born at 32 weeks to more than 90% for those born at 23 weeks or more, and even in adult death. Sorry, this is 24 weeks. Also, preterm labor have psychosocial and emotional effects on the family and increased cost for health services, because it may lead to increase in the incidence of admission to a natal care unit, and this will be costly for the family and even for the country. How we will predict a case who may have preterm labor? Because it is a common disease, so we will screen for it. How we will screen for preterm labor? In every case, any pregnant women, first of all, we will start with history. We will ask the patient if she has any risk factors that we mentioned in the previous slide, and so we can categorize the patient either have risk factor or not for preterm labor. Any patient who have history of 1 or more preterm labor will be highly risk to develop it again in her subsequent pregnancies. Those patients who have history of preterm labor or have any risk factor for preterm labor, how we will screen for the incidence of the recurrence of preterm labor is by the measurement of the cervical length. We will measure it between 20 to 24 weeks of gestation, and this measurement occur in asymptomatic women. If the cervical length is 15 millimeter or less, that means that this patient are risky or is risky to develop preterm labor. The other important test that we do for those patients who are at risk of preterm labor because of their risk factors is cervicovaginal fetal fibronectin test. What is that? Fetal fibronectin is a glycoprotein that should not present in the vaginal secretion between 22 to 36 weeks of gestation. If it is found in the vagina between 22 and 36 weeks of gestation, this will predict the incidence of preterm labor. The test is done by special kits that inserted in the vagina, in the posterior vaginal vault, and if it is positive, that means that this patient is risky, and we will do to her the measurements for prevention of preterm labor. If the value is more than 50 nanogram per ml, that means that it is positive. How can we prevent a case from having preterm labor? First of all, we should ensure the gestational age of the woman, either by early dating scan or by her LMP, because many women may present to us and she thinks that she may have preterm labor, but when we calculate her gestation by ultrasound or according to her last menstrual period, it will appear that she's term and not preterm. Then another method for prevention of preterm labor is to treat the infection. Any infection that occurs during a pregnancy should be treated. Asymptomatic bacteriuria, for example, is very common, and we should screen for it during a pregnancy and treat it. Bacterial vaginosis, which is one of the lower genital tract infection that may occur during a pregnancy, and if it is occur, it can lead to cervical weakness and preterm labor. So it should be treated by oral metronidazole, 400 milligram twice daily for 5 days. Patient in the second and third trimester can take metronidazole orally. What is the role of progesterone in prevention of preterm labor? There is many researches that discuss the benefit of progesterone in prevention of preterm labor, but we should not give it routinely to any woman. We should give it to patients who have previous history of preterm labor or patients with short cervix. When we do ultrasound for them, and the ultrasound reveals a short cervix, which is less than 15 millimeter. Then one of the methods of prevention of preterm labor is the cervical circulage, and we will discuss it in the subsequent slides. Cervical fetal fibronectin test, lifestyle modification, psychological support is very important, because any stressful condition may be the cause of preterm labor in the woman. Sexual abstinence is not included in the prevention of preterm labor. And even bed rest, if the patient have continuous bed rest, this may be a factor for increase the risk of preterm labor.